know that steroids are banned generally in sport. Okay, just recently, tramadol was not a banned substance for so many years, right? But tramadol has become a banned substance, all right, from January 1st, 2024. And that's a more recent update. A lot of people use tramadol, okay, but I'm not sure, so many people understand that it's now a banned substance. Now, how do we get people to understand these things? You get where you can access the information in the first place.
Welcome to this Game of Legends podcast. This episode, Legends and Sports Medicine, is a conversation about the challenges athletes face regarding doping, drug abuse, and the importance of education and access to healthcare in sports.
Hello, everyone. On another episode of this Game of Legends, I have the pleasure of being here with Dr. Jimi Osinaike. He's a medical doctor, a physician for athletes, also a PhD student in Sheffield Hallam University. Dr. Jimi, thank you for joining me on this Game of Legends.
Thank you so very much for having me. I'm really so excited, to always talk about anything, athletes, health and well-being. So once again, thank you so very much. I really do appreciate it.
Fantastic. So, in this Game of Legends, we talk about sports, we talk about athletes, and as a medical practitioner yourself, you've done a lot of work with athletes, especially in the areas of doping or anti-doping. I have a company called Remote Global Sports. We teach athletes, we mentor athletes. And one of the challenges we have with athletes, especially in Nigeria, is that they start out with the right ambition, with the right mindset and passion, heading into sports, heading into the career. And along the way, while we try to monitor them, we try to follow up with them, we notice that they get distracted with life. They fall by the wayside, if you may, and they go into the life of drugs. I think that's a good place to start with your experience and your expertise. What are the dangers of drugs, drug abuse in sports and as an athlete?
Thanks so very much. And that's a big place to start from. So, the average Nigerian athlete or footballer sees football as a gateway to their financial freedom. All right. So for them, it's usually football or nothing. Okay. And that's because they believe so much in their physical strength, in their talent, that through that they can make headway through sport, and hopefully that opportunity can help take care of themselves and their family financially. All right. So in instances where it doesn't work, we know that it will not always work out for everybody. I mean, the statistics are not so good. Not everybody would make it to that professional level, and not many people will make it to that dream football club they desire. So in instances where that happens, frustration can set in. All right. They feel angered that, they probably disappointed themselves. All right. Now, even before they get there, because they want to really make it in their children's sport, some of them would resort to using banned substances, okay, in order to maximize their performance, okay? So again, that is the trajectory that actually happens. So it's a case of we're passionate about sports. What can we do to maximize our performance so that we can get to that El Dorado of a sporting career? And in cases where they found out that probably injuries or something has happened, they can't make it there, they can have mental frustration, depression, and they can resort into use of these banned substances. So in that case, scenarios that can happen. And again, those that use banned substances, I mean, could be due to lack of knowledge, all right, could be due to lack of education. And again, some people will argue that, well, no player in Nigeria or no athlete in Nigeria doesn't know what a banned substance is. Oh, I do agree, but there are also people that don't understand some of these banned substances. And the reason why I always love to speak from a very broad perspective is that even some coaches or even some medical professionals are not aware of some of these substances that are banned, all right? Because these substances are on a yearly basis updated, all right? So we need to give some benefits of that ignorance, by mistake, by error, they make use of these banned substances.
Okay, thank you so much. Now, you mentioned that there is no definite set of drugs or banned substances. It gets updated every year. What is the right way? How can coaches, managers, athletes keep up with the list of this substance in order to avoid them, especially in a country like Nigeria, where many upcoming athletes, many grassroots athletes don't even have access to quality information, first of all, let alone certain information that are beyond their environment? What is the best way to go about this?
Well, now, just to track back a little bit. So we have substances that are banned that are on the World Anti-Doping Agency, all right, and they are oftentimes they are minor modifications or minor updates to the substances. So, for example, we know that steroids are banned generally in sport, okay? Just recently, tramadol was not a banned substance for so many years, all right? But tramadol has become a banned substance, all right, from January 1st, 2024, and that's a more recent update. A lot of people use tramadol, okay, but I'm not sure, so many people understand that it's now a banned substance. Now, how do we get people to understand these things? You get where you can access the information in the first place. Where can you access the information? So a lot of these, young athletes, grassroots athletes, coaches have access to the internet, all right, I believe. And it's just about where on the internet can I get this information. So there is the World Anti-Doping Agency website where you can get this information. There's also a website called Global Draw. Global Draw. So Global Draw is a website where if you're not sure of a certain medication, you could just type in the medication there and it tells you that this substance is it banned in sports, banned out of sports, or banned both in and out, of competition. So again, those are places where you can get those information. Now, secondly, there is a very high chance that an athlete or a footballer might not go to those websites. All right. I mean, there's a very high chance that they might not go to the website, not because they don't have an internet, not because they don't have a smartphone, but for whatever reason. Now, the onus or the responsibility therefore lies on the athlete support personnel, the coach being a very integral aspect, part of that personnel, to make sure that they are updated and that pass this information across to their athletes. I mean, as you're aware, most footballers, for example, respect their coaches. From my experience, even respect their coaches more than we doctors. Okay,
Yeah.
that's what I've seen from experience. So therefore, the coaches have a whole lot that they can use their will position. Yes, that's the word. Their will position to influence, their athletes, all right, positively as regards not taking this banned substances. So we need to really do a lot of more education with our coaches, all right, with also the parents as well. Okay, because a lot of parents also, believe that, oh, my son, my daughter can perform. So we also need to do a lot of awareness with the parents as well. Okay, these substances are banned, these substances are not good. These are places where you can get this information from so that we can use a whole systems approaches as well, to be able to tackle these things. And let me say this, I'm not saying that the footballers, the athlete themselves should not. All right, they should, but they're likely not to. All right. The coaches, other support personnel, if they have access to doctors or physiotherapists, then these support personnel must ensure that they go online, get in touch with relevant bodies to get this information.
Okay, thank you. I like the part where you mentioned that parents as well. I am very keen on parents. When I coach or mentor athletes, I make sure that parents are involved. One of my theories is that when an athlete gets the support of their family, they are 50% into their careers. There's a boost. Their chances are significantly increased. Where the parents come in with the drug issue or the doping issue is, as we all know, majority of our athletes come from very poor backgrounds, and it takes significantly a higher access to education to understand these terminologies, these medical conditions, these world government bodies, these conditions set by the world government bodies. In a case where we have athletes, a lot of athletes in the remote areas at the grassroots levels with little or no educational background, what else can we do when the coaches are not there and the parents are not adequately educated enough, informed enough to guide their words? What else can we do? The government, society, people like us, well-meaning Nigerians.
It's thank you for this question. Really happy about this question because I don't think we're doing enough in terms of creating bespoke educational materials for our context, right?
Yeah.
We're not doing a lot. We kind of set to focus on national athletes, all right? I mean, national athletes would readily have access to those information, okay, at the national body. But at the grassroots, you just paint a scenario now of athletes with parents that are not literate. What should we do? Very simple. We need to begin to get this information, redesign this information for people to really understand. It could be as much as sending it via SMS, short message services. These medications abound in sport. It could be things like printing a booklet. In fact, that's one of the things that all culinary future are desired to do. All right. Get all this information, probably get them in pidgin language, get them in Yoruba, get them in Hausa, roll these things and let people understand this thing so that we can help people. We need to design materials that fit into our context. It's not about reinventing the wheel, but it's just about getting this information and how can we make sure that a market woman, that ER lawyer that doesn't really understand going into the WADA website, how can we get the information on the WADA website to the market woman? How can we get it in front of the doors? All right. How can we get it very accessible to people around us? I think that is the way to go. There are really no shortcuts about it because this information, it's a global information. And that is why any player that is caught doping, for example, it's not an excuse. I mean, it's a serious offense. How can we help them? Helping them means that we making this information readily accessible to them and redesigning information to actually fit into our own context. And that could be probably doing it in different languages, easy to read approach and all that.
Okay, I like that. I'm very interested. Please, I will not wait till the end of this session to let you know. Whenever the point comes where you start to design this systems.
Collaborate really. I think
Yes,
I mean, let's collaborate. Let's put things together and let's design things. So I'm really happy to do that. And when the time comes, I'll definitely give you a ring.
Fantastic, please. So to go on to something else that bothers me a lot about the grassroots aspect of Nigeria when it comes to athletes is one thing I've noticed is health is secondary when it comes to our athletes. Looking after their physical health is secondary. Mental health is not even a conversation. It's like rich people problems, mental health. As an African, mental health, what do we consign us is for big people. We are. So two things I would like your opinion on is number one, when it comes to the physical health of athletes, how can we push them to understand the importance of their health? It just bothers me so much because in the space of 3 years, I have heard of deaths of young boys just last month. I'm in Lagos State, by the way, currently in Lagos State, and I am involved with a couple of grassroots clubs, academies in different capacities. One of the newest academies I joined, I got the news from one of the coaches that one of the kids passed away.
Wow.
Just a couple of weeks ago. I couldn't picture the face, but it was devastating to me. And that was just one of several cases I've heard of.
Mm.
So we see that it's bothersome. And the rate at which this happens, the ones I've heard of already, that I've heard of more than 10 in 3 years, the ones that I know, athletes that I know that have passed away, more than 5. And even on a national level, Tiami, you have heard of the guy that passed out on the pitch a couple of years ago.
That's United.
Yeah, thank you. how can we push for athletes to think of their health first? They don't seem to understand that their ambition, that their career will be jeopardized if they do not pay attention to their physical health. How are their organs? I would like to see grassroots clubs prevent players from playing if they've not eaten, if they're not properly hydrated, for instance. What can we do? What can we do? I'm sorry, I'm throwing all these questions at you. You're the first health practitioner. You're the first doctor I've gotten on this podcast, so everything is coming at you.
No, it's good. I'm really passionate about this topic, and whatever we can do to educate people to make our voices heard, I'm 100% in for it. Now, I've got a brand called WakaFit, and part of what we're doing, I'll relate to that question very soon. Now, just before I left Nigeria, I was working in a orthopedic and a sports medicine clinic, and in that clinic, in fact, the medical director of that clinic is very passionate about helping young athletes, helping them to manage injuries. Sometimes we even see them for free and every of those things. Now, what did I realize? I realized two things. Number one, yes, there's an issue of money accessing, healthcare, but there's also an issue of ignorance.
Hmm.
There's also an issue of ignorance, which, in my opinion, all right, no research has been done about it, all right, from my own experience thus far. Ignorance and this lackadaisical attitude towards their health is a very key thing. So I did set up this organization called Worker Fit Brand, and one of the things we decided to do is how can we make sports medicine care accessible and affordable? And recently, we did just roll out a particular program that athletes with as low as 1,000 naira can access physiotherapy. You can see a sport physician. Just pay 1,000 naira monthly and all of that, and you'll be seeing this, and they'll be subsidized. Now, do you know that I did bounce this idea with a club, and the club was like, well, we don't really get injured, so we don't need to sign up for that. So for them,
Sorry, is this a registered premier club or a grassroots club?
it's a grassroots club.
Okay.
It's a grassroots club. And you know that grassroots clubs are getting more structured in Nigeria now because they're going to send a lot of players outside. All right. So for some of them, I know for some of them it's money, but for some of them it's still an issue of they're not just bothered. Now, this grassroots club was telling me that we don't usually get much injuries. Our players only get injuries when they have a match, just on match days. And I was trying to tell this coach or the admin of that club that, see, ideally you should have a physiotherapist and or a doctor with your club so that when players have maybe a knock, they're not feeling fine, they're having a headache, they can easily just knock on the door of the doctor or the physio. So I said that's the reason why we're bringing this to you. We know that some of you might not be able to afford, a doctor, a physio, but we've created a program where paying 1,000 naira monthly, for example, all right, can get you to see a doctor, all right? And if you have to do physiotherapy, to be discounted up to 75%. All right. But the issue for them was that, see, we don't get injured and we might not need it.
So
So
they get injury now by force.
yeah, so for me, it was not like, okay, there's a big problem. There's a problem of educating these guys about the fact that it is not until you get injured. There's something we call injury prevention.
Yeah.
In fact, nobody wants you to get injured because if you get injured, you're not likely to even have enough finances to take care of it. Now, we've seen players going on Twitter soliciting for help to do a surgery, this and all of that. We can't keep on doing GoFundMe for people to actually do surgeries, for their ACL injuries and all of that. So it is very better we just prevent it or catch the injury at a very early stage. At a very early stage, because a lot of these players have a knock, for example, they just put aboniki or just use diclofenac and they just feel well and they go back to it until it gets to a point where the knee eventually gives way. The knee eventually says, I cannot go anymore. And at that time, they go and see a doctor, they go and see a specialist, and tell says, I say, you need to do an MRI. You get, you say, oh, doctor, I've done X-ray, now X-ray did not see anything. Doctor will say, well, X-ray does anything, but you're still having pain. They do an MRI. MRI is like close to 100,000 naira in Nigeria
Okay.
now. Yeah, most of them are not able to afford it. But could they have rested that knee earlier on? Could they have probably just done physiotherapy? In fact, even professional players will say, oh, they're out of sport for like 4 weeks just to rest their leg because they've been advised by the doctor. But for our people, they really don't understand this thing. So we need to do a lot. In fact, education is very key. I mean, just the other day, one of the clubs, grassroots club, told me that, oh, one of their players was playing on the pitch and the player slumped and died. And I'm like, oh, okay. The player slumped and died. I was like, when the player slumped and died, was there anybody that was able to do like a CPR for that
No.
particular player that died? Because we know that CPR, all right, following a cardiac arrest, has been shown to at least it can help salvage the life of that person. I asked the coach or the admin what that person is. Did you guys have a link hospital? Your club, do they have like an hospital around where you can easily rush your players to? And these questions can't be answered, all right? Because it's for them, it's just about playing football. But football is sport generally is an high risk occupation. So it's going to come with hazards of injury, people are going to collapse, and all of those things. So we really need to do loads and loads of education. We need to bring the coaches together because the coaches are one of the major problems. I think I must say this. The coaches, the club owners are a big part of this problem. All right. We need to bring them together. Tell them, see, this thing is this. And begin to do a gradual education, and hopefully one day, very soon, they will get it.
Hopefully, hopefully. So, well, as a footballer myself, I was once a grassroots athlete many years ago before I traveled. I played in Dubai for about 10 years, played in the Netherlands for about 6 years. I got injured last year. I had a major surgery on my wrist. So when it comes to injury, I have had my share of injuries over the years. So, but the thing is, now I'm going to come in on behalf of grassroots athletes. There are two things I have observed. Number one, as a young athlete, I can imagine 16, 17, 18, 19, 20 years old, ambition, the passion, the drive, the determination to make it, to get a professional contract, to impress scouts, agents, coaches, managers. I've been there where a couple of knocks, I tell myself, no, this is just a distraction. I have to keep going. I tell myself I have to keep going. I mean, we get news of how sacrifices have to be made. You have to endure. You have to keep going no matter what. And a young man or a young woman who wants to make it by all means, see those things as distractions, want to go by all means. That's number one. Number two, we know the kind of society we live in. Majority of athletes in Nigeria, this is my own opinion, might be an unpopular one, have no business being athletes. Like it's been established. They just go into sports or into football because they want to get rich, quick, money-making scheme. And very importantly, as an escape from the harsh realities. I still train here. I'm trying to recover. I train with a lot of players who say, hey, look, we might not have the chances. We might not have the opportunities to travel, to play professional, but we can leave the house. There's no food. There's no money. We can leave the house to go play a game, sports that we love to play. At that moment, within a couple of hours, we're not thinking about any other thing. We're just playing football. We're enjoying ourselves. So how do we convince this set of people to take some rest, sort some medical assistance? How can we convince them?
Right. Big question again. I think you're already asking me big questions. Okay, but I like this because I think it's more interesting now that you've made me aware that you also understand what it means to be a grassroots footballer, to play abroad, and all of that. These players, number one, they don't even have. Some of them don't even have the basic education. Now, what education does for you is it gives you a wise thinking capability.
Yeah.
It gives you a wise thinking capability. Now, I presently lecture in a college here in England, and I do lecture sports. And in this college, there are a group of footballers, all right, that are on scholarship. So they play for the academy team of a non-English league side.
Mm,
Right.
mhm.
But now, the way the football education sector in UK set up is that at least people can still go to college, do a degree of maybe on coaching, physical activity, exercise, and all of that. And you understand that the attitude of these guys towards injury is top notch. They are educated. So you're not even dragging them or you're not explaining to them why, if you have a knock, go and rest or something. So they can relate with it. So education has a way of helping you to be able to relate with a whole lot of things. So these guys that are, that just wake up one day because they have talent, they've not gone through the rigor of education. All right. It will be very hard for them to really understand when you say, well, if you have a knock, just go and take a rest. Instead, they will think that you're trying to like witch hunt them. And I mean, I've worked with the under 15 Nigerian national team. Yeah, I've worked with them. I've traveled to Japan to go and play an additional tourney, a 4 nation tournament. And you'll be amazed that this guy will not want to come and talk to you as a doctor because they are afraid that, okay, if I go tell doctor now and I say I get injury, I
Come to
get this,
rest.
the doctor go tell coach. Coach will go say, make I no play.
Come bench me next year.
Exactly. Come
I
bench game.
I understand. I never used to like talking about my
Yeah,
injuries.
and the bench fitness game. Now, even if oftentimes they now play through that injury, they probably go through that tournament, but you just find out that in 3 years' time, you ask them, oh, how far now? You see they play football. Doctor, you remember that knee will do me that time?
Mm.
That thing disturbed me, and I don't even play again. I'm like, why didn't you tell me then? Doctor, you know if you understand, Jerry. Making them understand and see if you speak to a doctor, oftentimes very early, we can salvage that thing. So we need to begin to make them, change their impression, the impression they have even about injury itself, the impression they have about their physiotherapists and their doctors, change those impressions. They need to be able to understand that, doctors, physiotherapists are there to help them maximize their performance, not to try to witch hunt them, from playing. So again, these are the things we need to come on the round table and begin to discuss. And why this is better because some of these things are not issue of money first.
Mm-hmm.
They're not issue of money first. They are issue of realizing that because I'm sure you know that a lot of them have money now. Besides, they go to one Baba in Oshodi to go and fix their leg, and the Baba will collect, and that local man will collect maybe like 5K from them. So, and I say, come and pay me 1K or come and pay me less. But why would they come to me? Why would they not come to me? They're like, all these Oyibo doctors, before they will now tell me something that my ACL will rupture. Meanwhile, one of my friends, when doctor tells ACL rupture, go to one Baba for Oshodi and Baba fixing leg.
I like how they make it seem like it does not exist until the doctor says it.
Yeah, exactly. So that's why I'm strong at this moment to tell them that come and pay 1,000 naira monthly and 1,000 naira if you need to see a doctor. But they will rather go and put that money. You played in Dubai. You see your doctors and you see how they talk to you, how they help to you, how they say, okay, if you're having an ankle pain, just strap it. It can help you. Okay, you might have to stay up the game maybe for like 4 weeks, or we give you some medication, rest, and all of that. You see how they helped you. But in Nigeria, it is not so. At the moment, it's not so. So we need to really do a lot of just speak to them, come down to their level. I know that some of them might have had some bad times with medical doctors, and I know that some might have other realities of when maybe a doctor misdiagnosed them, and they just, and again, a lot of them have gone to the local people and they've gotten good results from the local people. I'm not saying the local people sometimes don't give them good results, but I'm not sure a local person can treat an ACL rupture. I'm not sure a local person can treat a meniscus damage. All right.
Thank you for tuning in. Hope you enjoyed it. To follow our journey on this mission, kindly do not forget to subscribe and check us out on social media. Until next time.